I'd like to really warmly welcome and introduce our opening remarks by Susan Pearce, AM, the Secretary for Health. Susan was appointed as Secretary of Health in March 2022, and as Secretary, she's responsible for managing and overseeing a health system that includes over 142,000 staff and a budget of over $30 billion. So if you think your job's hard, you know. Many of you will also recognise Susan from her previous role when she was controller of the State Health Emergency Operations Centre, and you saw her on the TV every day, responsible for directing and overseeing New South Wales Health's operational response to the COVID-19 pandemic. So Susan also began her career as a registered nurse in Broken Hill and has continually worked to serve the communities of New South Wales. So you might not know that Susan's also admitted as a solicitor in 2019 and was appointed as a member of the Order of Australia in 2023. So please welcome the Secretary for our opening remarks.
Thank you, Ben, for those kind opening words. Could I also add my acknowledgement to the traditional owners of the land, the Gadigal, and I pay my respects to elders past, present and emerging, and I also acknowledge it was and always will be Aboriginal land. Look, thank you for having me this morning, and I think reflecting on my career across New South Wales, which now spans many, many years. When I started training to be a registered nurse in 1988, things looked quite different across the health system than they do now. And one of those reflections that I would make is that the hospital system obviously has a very dominant force in the minds of people who work in the public health system. And for those of us who started our careers in hospitals, you sort of feel like, you know, the whole world revolves in those four walls that you exist in. And what we've learnt over many years now, and I think we are getting better at this, but we've got a long way to go, is the role of people who support us in community health navigation. And I think the pandemic was certainly a time, from my perspective, where we learnt that lesson the hard way. You'll remember that we had those, you know, at some, I mean, I certainly obviously stood in the shadows of my colleague and friend, Dr. Chant, but everything that Dr. Chant decided was a good idea from a public health perspective, there were people in the background trying to work out how on earth we were going to do this. And part of that was obviously the accumulation of ICU bed capacity and ventilators and all of those things that you heard Premier Berejiklian talking about. But what really we should have been focusing on more was what was going on in the community. And I guess it's easy for me to say that now with the benefit of hindsight all these years on, and it feels like in some respects, did that thing ever happen? But of course we know that it did. I was responsible also for hotel quarantine, for testing clinics, the vaccine rollout, as well as at ICU capacity. And when Delta hit with our famous limo driver, if you remember the limo driver, that man only seemed, bless him, and I sort of felt a bit sorry for him in the end, to be honest. It was almost like he only needed to look at someone and they, you know, got the Delta strain of COVID. What happened at that time was, yes, we were well equipped with our ICU bed capacity, but the community response was far from ideal. And that's one of the biggest learnings from my perspective during that time. Now, what I mean by that is that what we should have realised was that 95% of what was going to happen when people did get COVID, and the eventuality of it was always going to happen, was that most of those people would be at home. And so, you know, here we were with all of this ICU bed capacity, which we never got anywhere near. I mean, don't get me wrong, things were tough in the hospitals. I'm not suggesting otherwise. It was incredibly difficult. But what was more difficult from my perspective at that time was we had to very quickly pivot and work out how on earth we were going to communicate with people out in the community. And so for me, what that looked like, both in terms of giving information to people in the community, but also when it came to the vaccine rollout, was again needing to learn very quickly. For example, in Aboriginal communities, and particularly in some of the western parts of New South Wales, but all over, that non-Aboriginal people turning up saying, "Hi, we're here to give you your vaccine," just wasn't going to work. Similarly, in other cultural communities, we needed to rely on faith leaders, cultural leaders to assist us to get that work done. And I guess my message to you fundamentally is that we are aware of the incredible work that goes on out there every day across New South Wales that doesn't happen anywhere near the four walls of a hospital. Now, I do need to get that bio updated because we've actually got 180,000 headcount staff across New South Wales Health. 140 is FTE, so it is big. And what we also, I think, need to continually take the opportunity, and last night I had the opportunity to be present with some peer support workers being recognised at the South Eastern Sydney Staff Excellence Awards, is to recognise that there are other people delivering care out there, aside from nurses and doctors and allied health and so on. What we know about health systems as well is often the people who need them the most find them the hardest to access. And we know that depending on where you are and what you do and where you live and all of those things do impact how people access healthcare. Trusted faces in the community, people who support this work as community health navigators, are critical to the ongoing growth of the New South Wales public health system and indeed public health systems across the world. And one of the things that I often reflect on, given that I lived and worked in Broken Hill for 10 years in the early part of my working life as a nurse, and I'm still registered to practice as a nurse, would you believe? I just offer a warning disclaimer. If you ever see me in a uniform, I would strongly suggest you avoid me at all costs. But it's something that has been a very precious part of my life, and somehow I just can't let go of it. Having said that, in the sort of job I'm in these days, you never know when you might need some sort of other employment option. But it is, it is an opportunity for me to just, I guess, remind our health system and the people who support it that some of the things that we've always done work well. But if we keep doing what we've always done and expecting our system to change and to grow and to meet the demands of society without doing anything different, it just doesn't work. It just doesn't work. And I think that helping people to understand their diagnosis and treatment options, helping them get to appointments, helping them navigate through the system. Look, as I said, I've been in and around the New South Wales public health system for almost 40 years. And unfortunately, a couple of years ago, my husband had prostate cancer, which was not what you wanted at 55 years of age. Navigating through that journey with him, even from where I sit in, and I'm not suggesting anything untoward in terms of asking for things that in advance of what he or I were entitled to in any way, but just working out how to join the dots between parts of the health system is not an easy thing to do. The paperwork, the follow-up, the translation, the jargon that health professionals absolutely love. As I've touched on the Aboriginal community, one of the things that I would like to also reiterate to you today is that when you end up in a job like this one, people start asking you within about 3 seconds, well, what would you like your legacy to be? And it's like, well, you've got to work out what you're doing before you can worry about legacy. And I think if you start worrying about your own legacy too much, you sort of lost the plot a bit. Other people will decide your legacy, I think. But one of the things that we have very strongly focused on since I've been the Secretary of Health for the 3 and a bit years now is Aboriginal health. And I gave an apology to the stolen generations for the first time in New South Wales history 3 years ago. And when I did that, I was, this sounds weird, but I was grateful that I was the secretary who did that. My concern was that it would be another non-Aboriginal person standing up and making an apology and ticking a box, and off we go. So we are absolutely committed to doing better. And again, in terms of community and Aboriginal community and navigation through the community, we know we can't do it alone, because closing the gap, it's not closing. So if we're going to be honest with ourselves about what we're doing here, we have to be honest about the fact that the great endeavour and the work that's gone on is making tiny incremental steps in the right direction, but it's far too slow. So there has to be a different way, and I think working with community and helping our Aboriginal brothers and sisters navigate their way through the community to see trusted faces within the health system at all levels. We've got 180,000 staff, as I said. There is ample opportunity for us to increase what the profile of the health staff looks like. And of course, that doesn't just stop with Aboriginal people. We are very blessed in New South Wales Health to have a wonderful multicultural workforce. And I think that, you know, as I said at another forum, and I think I was a Southeastern thing last night, the world's hard at the moment. It feels hard. It feels a bit scary. There's a lot going on. There's a lot of hate and vitriol in society, and there's a lot of trying to squash the work that we're all committed to, and that includes standing up for diversity, inclusion, and the empowerment of our staff from all walks of life. And from my perspective, what I would like to see is that across New South Wales Health, and I mean not just within the hospital system, but beyond that into the community system, supported by our partners, is that people can come to work and be their true selves at work, and support people in the community to be themselves as well. And I know that you all play a very valuable role in that. One of the things we've done recently, which I'm really proud of, is, and look, and don't think I'm Pollyannaish about the New South Wales health system. It is a hard place, full of complexities and issues and challenges. Despite it all, somehow I remain optimistic about it after all these years, because if you didn't, there is no way you could do this job. But recently, or go back a few years, in about 2013, I was the Chief Nursing Midwifery Officer for New South Wales Health, and we made a film called Small Acts of Kindness. And I hope some of you have had the opportunity to see it. I'm proud to say it has stood the test of time. When I first showed Brad Hazzard, who was our Minister for 6 years and 53 days, that film, his reflection of it was, oh, geez, you've lost a bit of weight since you made that. That sort of wasn't what I was going for. The objective of that film was to remind our health staff that it is kindness and compassion at the heart of everything we do. And I know that the work you do delivers that in spades. Last week, we launched Small Acts of Kindness Part 2, Kindness Lives Here. And this time it focused much more heavily on our staff and our patients, clients and carers, and a wonderful reflection of the New South Wales health system. So even though things are a bit hard, a lot hard, I think it's our job to continue to promote these values and to think about what it is that we're all here for. And just this morning, and I've been up to the Newcastle Linen Service, who do an amazing job as part of New South Wales Health. I got an email this morning from the guy who runs that service, and his commentary in it I thought was lovely. And it says, when the lights don't work, kindness does. When the warmth is not available, kindness will provide that. When the power stops buzzing, kindness is an abundant source of energy. For 10 hours, for 216 staff, for hundreds of customers, for the family that is Newcastle Linen, kindness kept the entire process running. Kindness can reach further than most can imagine. Authentic, natural and purposeful kindness lives here. And what we've been trying to do through that work is to, again, promote the fact that whilst things are tough and hard and there are KPIs and there are budgets and there are challenges, at the end of the day, we're all human. And I'd like to thank you sincerely for the work that you contribute to and the work that you do on behalf of many people across New South Wales, because without you, their journey through what is a very complex and challenging health system would be much, much harder. The other side of the kindness agenda indeed is that there is evidence, statistical evidence, that it does improve health outcomes. And wouldn't you know that being kind to other people actually makes you feel better about yourself as well. So look, really, I've got all of these dot points here, which, as you can see, I haven't paid much attention to. But in the end, I guess my message to you is that we are a human health system. I think that from a bureaucracy perspective, people have a lot of impressions about what people who exist in massive bureaucracies like New South Wales Health stand for. From my perspective, it really is about people supporting people, people walking with each other through the most difficult and challenging times of their lives. The fact that we hold a unique position in the lives of people who tell us things and share things with us that they would never tell anyone else. Being able to help, make a difference, have purpose in life is all part of what we all do. And in the fullness of time, in the years that I have left in this role, hopefully it's years, it is certainly incumbent upon me, and it's not lost on me, that we can do a lot better by embracing people who work in the community to support the system that is New South Wales Health, who, despite its challenges, is a very, very, very good health system. But it could be a lot better. I think if it extended itself beyond the acute care system, and let's think more deeply and work together about what that can look like into the future. I'd like to thank you for having me here this morning, and I know that you've got a busy agenda today, so I'll close off there, and I'd be happy if you wanted me to take any questions, but only easy ones, but up to you. Thank you.
We might have time for one question.